Hello, my beautiful friends. Welcome back to my channel. I hope you're all having the greatest day today. To say that I'm excited to finally be sitting down and filming today's video would be an understatement. I know I say that a lot about a lot of my videos, but I am 38 weeks and 5 days pregnant with baby girl, and I am finally sitting down to film what's in my hospital bag. That is not how I normally operate. I'm usually very planned and organized, and I have been like setting things aside for a little bit to get ready for this, but baby girl is just hanging out in there, and I am not in any way, shape, or form going into labor. So I feel like I have a lot more time than I probably do. So I've been kind of procrastinating a little bit. And also I was really sick last week, so that didn't help either, which is why I still sound a little nasally. So bear with me through that. If you guys are new here, welcome. My name is Rachel. This is my second pregnancy. We are expecting a little baby girl. We do have a 2.5-year-old son, Xavier. He was a scheduled C-section because he was breech. We do have a C-section scheduled for baby girl for next Friday. But I do have the option for a Vbac as well. So if she decides to come before that date, that's the route we're going to go. I just don't think that's going to happen. With that being said though, what I pack for us in our hospital stay and in my hospital bag, there's literally one thing that I'm bringing if I have a vaginal delivery or I go into labor on my own versus having a scheduled C-section. So I think this could go if you're looking for advice or tips on either way of delivering. So I hope you guys really enjoy. I'm super excited. A couple things I do want to mention first. I've watched a lot of these videos over the years. I just enjoy watching them, and I enjoy seeing like different things that people think to take that are just really genuinely good ideas. I do also, however, see a lot of people take so much unnecessary stuff, like things that the hospital is going to give you. So my first tip before you even start packing your bag, call the hospital where you're going to be delivering and talk to labor and delivery and find out what they provide you. Okay. I know, and I've already delivered at this hospital before, and my aunt is a NICU nurse there. So like she's my, line of contact if I need to ask her something, but I did have her find out about newborn pictures because I knew that if they weren't doing them, I just wanted to know. But also find out what they're going to provide to you. I know that they're going to give me a huge water jug, so I'm not taking a water bottle with me. I know that they're going to give me diapers and formula for the baby and a pacifier and a sleep sack and burp cloths. For me postpartum, they're going to provide me mesh panties and pads, dermaplast, witch hazel pads, a peri bottle, like literally everything that you would need. And I see so many people packing that stuff. I just think it's such a waste. It's just stuff they're going to give to you anyways. Like packing a separate peri bottle because it has like a weird extended thing on it, like I just don't think is necessary. And you're just going to have to unpack it when you get home. Who wants to do that? So make it easy on yourself. Call the hospital, find out what they're going to provide to you. And then this way, I didn't wind up buying a lot of postpartum stuff because I knew that I was already going to get it from the hospital. So, and then if I do wind up having a vaginal delivery, I already have in my phone like a perineal, I can't say that word. Spray by Earth Mama in there. I have like a couple things. So if I do go that way, I can literally hit buy now on Amazon and it'll be at my house by the time I'm home. So I would do that. I would also make sure I did not do a birth plan this time. Okay. I did a very, very specific one with Xavier. And all of it went to shit once I found out I had to have a scheduled C-section because he was breech. So I was devastated, to say the least. And it still bothers me to this day. At the end of the day, you are just delivering a happy, healthy baby. And both you and the baby need to be happy and healthy. So at the end of the day, it does not matter how you get to that point. I know emotionally, like, and mentally it could be a lot, and I truly understand that. But you have to be flexible. You have to be able to go with the flow of things. I'm not saying don't advocate for yourself. I'm not saying don't If you don't think something's right, like don't fight. I'm not saying any of that. All I'm saying is don't be such a hard head that you just allow it to impact your whole experience, because it did for me last time. And I'm still upset that I feel like I'm going to have another C-section. I really want to have a vaginal delivery, but at the end of the day, it is about getting her here healthy and no complications for both of us. So just be aware that things don't always go to plan, okay? Also, I do think it's important, though, that you have a discussion with your partner, spouse, whatever that situation looks like for you, and find out what you would like to happen. Things that are a hard no, things that, like, yeah, I want an epidural. I know that my fiance is very skittish when it comes to medical stuff. So for him to cut the cord, like, I don't think he would normally think about that. But I know it's something that would come up if she comes on her own. I don't know that he would do that. So just like plant those seeds ahead of time so that they can at least think about it. I'm honestly more nervous about him like passing out as I'm like birthing her than anything else. So just be aware of like their sensitivity level, and where they kind of stand with all that stuff, but also make sure that they're aware of what you expect too. Like, I know I can't have morphine because if I do, then I get really itchy and then they're going to give me Benadryl. And then that is all in my birth story with Xavier, which was a nightmare. For those of you who are new to my channel or have not watched my cancer videos, I had breast cancer. I had a double mastectomy. I have no breast tissue. There's just implants, no milk ducts. I don't have nipples. I cannot breastfeed. That was taken away from me. Eric knows how sensitive of a subject it is for me, and he knows to make sure that everyone knows not to approach me about it. Which a lot of hospitals are very pushy with it, which I get. I wish I could. Different situation for me. Also, I cannot, because I had lymph nodes removed on my right side, I cannot have a blood pressure cuff and IV needle pricks on my right arm at all. So that is something to be aware about as well. So just make sure that your significant other, spouse, whatever the situation is, knows things that they should, okay? Or write it down and give it to the medical staff, whatever is easier. And then also make sure that you have plans set up in place for childcare, animal care, and then backups to all of that too, because things can happen. So you don't want to be scrambling last minute because you forgot that someone's going to have to come and let the dog out midday because you don't know when your significant other is going to be able to make it home. So just weird random things to be aware of. Now, because this is our second child, I am going to leave a couple different things in the car that don't really have anything to do with my hospital bag, but we are leaving in the car. Number one, well, let's start with the car seat. The car seat is sitting right there because I haven't put it in yet. The dog had to go to the vet yesterday. He's 95 pounds. I needed to wait on the car seat. But I'm going to put the base in. I'm not putting the actual infant car seat in because if you are in an accident, you can't use that seat anymore. So the car seat, I'm just going to leave by the front door with a couple other items that I'm not leaving in the car just yet. But make sure that at least the car seat base is installed ahead of time, especially if it's your first time putting one in. It's not the easiest always. But also because we are bringing our second child home, I wanted to do something nice for both baby girl and Xavier, to and from each other, if that makes sense. So I'll go over this quick because this isn't like a normal thing. But this is Mr. Fox. This is Xavier's favorite stuffed animal. He picked it out himself at Carter's, and I am not the type of parent that will just buy him whatever he wants when he sees something. That's not how I roll. But he grabbed this little fox and he just hugged him, and I'm like, okay, you win. And so now he has Mr. Fox, and it's still his favorite stuffed animal. When I went to Carter's a couple weeks ago, I found a pink fox. So Xavier and I have talked about it. And again, he's 2.5. Does he know? I don't know. But I asked him if he wanted to give Sissy a pink fox? And he said yes. So I said, okay, well, we'll wrap a pink fox together and then you can give it to her when she comes home from the hospital. Xavier will not be going to the hospital. They won't let him in because of the whole restrictions, whatever, which honestly I'm fine with. He won't understand why I can't come home with him and whatever. So he's going to give this to her when she comes home as a little welcome home gift. But I also got a little something for him from his sister. So my mother had this game. It's just like cans of fruits and vegetables, and there's different numbers in each. And he loves this game. So I ordered it from Walmart, I think, because Amazon, it wound up not shipping. And I'm going to wrap it in like a pink unicorn or llama paper, whatever I have from Christmas, and give this to him from her when we get home from the hospital. So I just think it'll be, and again, will he remember this? Probably not, but I think it's just a nice gesture for the two of them to do for one another. So just let me live my life. I'm kind of stressing out a little bit about bringing another baby home with our only child because he is number one, a mama's boy and the love of my life. And I'm, stressing out a little bit. So there's that. As far as, I guess the other thing that may be a little different that is not a necessity, if you will. I think it's just something nice to do. I love nurses. I have a lot of wonderful nurses in my life between family and friends. I honestly would go back to school to become a nurse just from all the medical stuff that I've been in. I have a great appreciation for what they do regardless of what their role looks like. So I wanted to do something nice for them. I ordered, and I have 2 boxes of these. I ordered 450 truffles from Lindt, which is a little excessive. 150 I am keeping for myself, but they have these beautiful little pink boxes with cherry blossoms, which could not be more fitting. But literally I ordered like as many flavors as I possibly could and packed these boxes. Oh my God, it smells so good. So there is also like a little booklet description of what they are. And then what I did was I have cards, one for labor and delivery nurses and then one for the mother-baby unit. And it's just a thank you, just saying how thankful we are that they're there to take care of us and my baby and how much we appreciate them and just a little thank you for doing what you do. Now, is that necessary? No. Do I think it's much appreciated? Yes. Do I think that nurses are said thank you or, told thank you enough? No. So I just think something like that is just nice to do. And it doesn't have to be a box of truffles. It could be just buying them coffee from downstairs. Whatever the case is, I just think it's something nice to do. So there is that. I'm trying to keep this in some sort of organized fashion and it's probably not going to work. So I was not going to bring my purse, but honestly, I need like my regular stuff. I need sunglasses for the drive there and back. Those are in there. I don't know whose car we're taking, but I need my license and health insurance card. And I don't want to have to like take those 2 items out and just leave them randomly in like some bag that I'm going to forget or wind up losing them. So I'm just leaving it there. The only thing I really did add into my bag are 2 things. I brought my blue light glasses because I plan on being on my laptop. And if you've never used blue light glasses before, they're a game changer when it comes to like your eyes not feeling exhausted. And I also have my MacBook to watch movies, shows. I have a ton of content that I need to edit, so for that as well. And it'll give me something to do. Also, you need, if I do wind up going into labor, you're going to need something to help pass the time. So, like, why not? Also, I have in here, this is my pre-admission form for the maternity unit. They say to send this in 6 weeks in advance. I also have my surgery information, COVID testing, all that nonsense. So I'm just leaving that right in that bag. So that's really it for like my normal purse. Again, I wouldn't normally take it. I'm just so nervous about like losing that stuff that I would just, and I need that accessible and that like buried in a suitcase as I'm checking in. So I have that. I did not grab my charging cable for my laptop yet because I'm still using it. But there's that. Well, I guess I'll do other technology stuff first. So my camera, which I'm filming on, I am going to be taking with me if I go into labor. I don't know that I can film at the hospital. Like if I actually go into labor on my own, I would love to. I don't know that they'll let me. But if they do, I'm going to have my camera just in case with my SD card. I have my little like flexible tripod that I'll wind up taking. My camera case. And then also in here, it has like just extra batteries and the charging cable for that. So I have that. I do also have in this little bag, and this bag is not going to work. It's busting at the seams. But I have like all my charging cables and stuff in here. I am not taking my Apple Watch with me. I don't need it. I'm not going to want to wear it. I just don't care enough. And I don't honestly want to have access to everyone who's blowing up my phone while I'm enjoying this time with my fiance and daughter. But I do have in here, I ordered 2 10-foot like lightning cables for our phones and whatever else. You don't know how close you're going to be to a power outlet. So I just ordered, I think these were like $12 or $16 for 2 of them, and they're 10 feet long. So I thought that would work well. I also have like my regular charger, which honestly, I don't need to take this because I forgot I have that. A little like battery power pack, which again, I don't know that I'll need. USB charger. And then I just threw both of my headphones in here. I have my Beats and then my AirPods. The Beats are noise canceling. I don't know that I'll need them for that, but I just threw them both in the bag because they're on my nightstand anyways. So there's all of that. Charging cables are seriously like one of the most important things, I think, because everything is so tech-based now if you don't have one, you're SOL. And then also I'm going to take this white noise machine with me. My whole theme, which I didn't really go over yet, the whole theme of every single thing that I pack is to make my life more comfortable, to make me feel more at home and not in a sterile hospital setting. And one of the things, we sleep with white noise every night because it's on Xavier's hatch machine, like his sound machine in his room. And then I listen to that on the Nanit app for his camera. So we sleep with white noise every night. So this is just a little handheld one for baby girls, like car seat, stroller, whatever I ordered from Amazon. And I just thought that this would be really nice to have for at night in the room. I can't sleep without it, so I need to take something like that with me. Also, as far as like, I guess techie stuff goes, or just, again, just being comfortable, I am taking a speaker. This one is a little obnoxious. I can't find our smaller one. If it pops up before, then we'll take this. Eric and I listen to music all the time. Xavier loves music. Like, we are a musically driven household, and we are very aware of our surroundings. We don't play it too loud, but we like to have background music. Also, if you are going to be in active labor, like a normal delivery, you're gonna want music to help your mood, whether it's classical piano music, hard gangster rap music, like rock and roll, whatever you're feeling in that moment to get you through it, meditation, it will help. So again, this, again, I think is a necessity because of just how we are as people. But you can also play it on your phone or laptop, whatever. Also, I'm taking an essential oil diffuser. This is something we use in our house all the time. Again, the smell of a hospital is not like my favorite scent. So I am going to take a specific scent. It's by the Young Living line because that's all I use. It's the Seedlings Calm. And this one is specifically for babies. It's pre-diluted, so it's safe to be around them. And it's just like a lavender, I think there's lavender, bergamot, ylang ylang, and coriander or something in here. It's a nice little blend. Yeah, coriander. And it's just a nice relaxing scent. So this I'm going to take to put in there just to, again, help us like just feel like we're at home. So there's that. And then, oh, the one thing, this is the only thing that I don't know If I go into labor on my own, I will take it. If I have a C-section, I won't. It's just a fan. This is a stroller fan with a clip on it, and I bought this for Xavier when he was an infant, and we've obviously never used it. It's still in the packaging. But that I thought was a great idea, with which a lot of people do pack in their bags, because if you are pushing for a half hour, 45 minutes, 2 hours, you're going to get warm. So a lot of people recommended bringing one of those. So I'm going to leave that out to the side, and if I do go into labor, I'll take it. If not, I'll leave it here. And then the other comfort items that I'm bringing, this might seem silly, but I've had, again, many hospital stays in my day, and I know what I like and what makes me feel good. Taking my pillow. I currently sleep with my pregnancy pillow, but it's massive. It's that big U-shaped one, and I'm not trying to take that. A lot of women do take it to the hospital with them. I'm trying to consolidate all of this into like one suitcase so that Eric is not running around with 12 different bags in and out of the hospital, like when we get there and leave. So I am taking my pillow. It is a nice foamy, cushy one, and it does have a silk pillowcase on it. It is not as bougie as you think. I got like 2 of them on Amazon for like $10. You can see it's like not the best quality. It's pulling and stuff, but it just feels so nice and luxurious, and I am all about that. And then also I am taking, oh God, a big fluffy pink blanket. I did not specifically buy this because we're having a girl. We've had this blanket. This will be in her room after it's done, or after she's here, because it matches. I've already washed all this stuff too, but if you've ever, between the pillows and the blankets at the hospital, like if you've ever felt them, you get them. Like you understand. The blankets are thin and scratchy. They're not comfortable, and you need 12 of them just to keep you warm. I am not about it. I want a nice fluffy blanket. Plus, you're going to have this beautiful little newborn baby on you. With Xavier, I took a blue blanket and we used it as a backdrop for his pictures. So you're going to be taking a lot of pictures. Might as well have, you know, a multi-purpose thing like that. So there's that. That I do really recommend. I do absolutely think that it's worth it to do that. I do also have her Hello World board. This is already pre-filled out, which is why I'm not going to switch it around, but it says Hello World, her name, May 2022, a spot for the time, pounds, ounces, and inches. And then I have the little easel to prop it up. And then I have a bag of numbers here. So I did do this with Xavier, and I pre-filled it so that I didn't have to do it when I was there. Of course, my battery died on my camera. So I just leave extra numbers in here. Once we get her stats and we want to take pictures, we can have that ready to go. Also, you can't see it. I am packing a hard case pink suitcase. It's not, I didn't buy it, especially because I'm having a girl. I just love pink. But this side of the suitcase has like the flap with the material. So I put that board in between the blanket and the pillow to keep it secure and the letters not flying off all over the place. So there's that. As far as other things, I am taking snacks with me because I love food, and the hospital food last time was absolutely horrendous. And there were times that Eric was not there with me because he does not spend the night with me in the hospital, and that's personal preference. I don't want him to. I would rather him be home and comfortable in bed. And plus we have a son now. I don't want him to be more disturbed than he's already going to be. So I have a bunch of snacks for both of us when we're hanging out together, but also like for in the morning if I want something and no one's there yet. Oh, my leg's cramping. So I am taking a big thing of Smart Water, and I don't think that that's really necessary. I'm just really weird about water. Like I can taste the difference between waters, and I'm not, it grosses me out, and I know I need to stay hydrated. So I'm taking this with, and then also I feel like my camera's all adjusted funny now. Anyways, I I'm also going to take these 2 Keto Bars. There's a birthday cake and a chocolate peanut butter. These Lily's sour gummy worms. I don't know if you can see. These are so good, and they're like no sugar added gummies. They're delicious. I'm going to take some of these Emmy's Organics coconut cookies. They're so good. These are the vanilla bean. And then a whole bunch of nuts. These are the skinny dipped almonds. These are lemon. I love anything lemon. And then dark chocolate peanut butter. And then for Eric specifically, I got him salt and pepper macadamia nuts. And then for me, I have regular macadamia nuts as well as cashews. That seems like a lot of snacks, which really it is, but I'm a picker and I just want like things that I want. I don't want to have to like worry about someone having to go down to a vending machine and like try to pick something that I might want at that point. So taking all that, and then I'm like, if I want other food, then I'll just have someone grab me something. But I remember the food last time was just absolutely disgusting. So I just like to be prepared. So we have that. And then as far as, what else do I have? We'll do this. So I am taking, well, I guess I'll do these 2 bags at once. I do have, as far as like the water goes, I am taking these liquid IV hydration multipliers or whatever they're called. I've never had them before, but I've actually seen a lot of people pack these in their hospital bags. So I figure I would give them a whirl, and then they're supposed to hydrate you faster than not drinking it. So I'm going to take a couple of those with me. Oh my God, now I have the hiccups. I'm also taking some Preggy Pops with me. So yeah, I'm going to take some of these Preggy Pops. These I used a lot in my first trimester for nausea. They're just something nice to like suck on. They have like kind of like a sour taste to them. And all this is like in this little pink bag. Everything is pink. Oh my God. I have a pack of gum. I have my vitamins. I have prenatals. I do have gummy ones left. And I find that they're easier on my stomach. I'm like really sensitive to that kind of stuff. So I have those. And then in here I have my folic acid and prenatal probiotics that I'm still using. So I have those. I know that my stomach is going to not be functioning the way it's going to be, especially if I have a C-section and they put me on Dilaudid or any kind of narcotic for pain. It's going to bind me up, and I just know how that happens for me. And then also I have packets of Ningxia Red from Young Living. I drink this stuff every single day. It's great for antioxidant support and immunity, like immune system. So I'm taking that. Got all those guys. And then my Thieves cough drops from Young Living as well. These Thieves are just awesome. It's just an awesome blend for like fighting off nasty and being in a hospital, you know. So, and Eric likes these too. So it's just something nice to have. I'm more of like a hard candy person than a gum person. But I thought it would be nice to have both in case one of your visitors needs a little something as well. So there's that. Also, this is my little essential oil bag from Baggage & Co. I got it on Etsy, and I have all my oils in here, as well as other stuff. I have probably 3 chapsticks scattered throughout all of this. You cannot have enough chapstick. Your lips are going to get so dry. It's just a dry environment there. So take at least 1 chapstick, if not more. In this bag, I also have, oh, that one's open, my Thieves hand sanitizer. In my purse, I have Thieves, sanitizing wipes. And then I just have like a bunch, I have other, not medicine, but supplements. I have my B12 and D3 and K2 spray. These are from Mary Ruth's Organics. I take these every day as well. So I have those in there. I have, my Thieves like surface spray. And then I have a whole bunch of different rollers. This is my immunity roller that I put on my back, sleep roller that I put on my feet. This is a breathe again one, so if I'm congested like I still am. My calm roller, this one, this one's just like a perfume blend. And then this one is my headache blend. So, and then I just have a bunch of like mood support oils in there. So that's really it for that bag. And again, it's nice that I know, like, if I need to tell Eric to get something, like, go in my white bag and grab this, or go in there and grab that. Like, it's easier when you have them in like little things so that you're not digging around for it. You know exactly where things are. So there's that. And then I have my toiletry bag. This is a Kate Spade bag I've had for years and years and years. I travel with this everywhere I go. It's like a, I don't know, it's got like a protective coating on it. So if it gets gross, it's whatever. So in here, I just have a bunch of like travel toiletries. I have makeup removing wipes. In this little bag, I do have my makeup brushes, my eyelash curler. I'm going to leave all of this out on my counter until we're ready to go, and then I can just pack it lastly. But also in here, I have like clips, and then I have hair scrunchies. I have little clips to keep my hair back. Just, you're also, same thing. Like if you're going to be pushing, you're going to want a hair scrunchie to put your hair back. Not that I know because I've never done it, but I would assume. So we'll leave that in there. And then I have like, I don't plan on washing my hair while I'm at the hospital. I typically wash my hair once, maybe twice a week. So either way, like if I go into labor on my own or have a C-section, I will like full blown get ready before I go. And yes, I will be wearing a full face of makeup. I feel better when I have makeup on. That's just the way that it is. So yeah, I do have a little shampoo and conditioner just because it's in this bag, but I'm literally, this is dry shampoo. I'll be living with that. Hairspray. I have my toothbrush. I have my little deodorant. I have makeup remover, like, it's like an oil-based whatever. I am taking little under eye patches. I remember feeling so swollen. And again, this is not necessary. But I remember feeling really puffy after my C-section with Xavier. And I just thought that this would be something nice to do after I give birth, or just like hanging with the baby at night, just relaxing. So I'm going to take that. I have toothbrush, toothpaste. I do have belly butter from Earth Mama. I have my little Lange, I don't even know if that's how you say it, a little lip sleeping mask. I have the water sleeping mask for at night, moisturizer, my little lip scrub. Again, is this necessary? No, but my lips do get chapped and it doesn't take up any room. If I need to use it, I have it. I have face wash in there. I have my little tiny beauty blender that is dirty, of course. And then I do also have this makeup removing oil, like the little Clinique one. And then I am taking, because I feel that I deserve it, I have this little like sample set of La Mer face products. So I have the treatment lotion, the eye balm, the concentrate, and then like the moisturizer. I want to purchase this set so bad because it literally is like, I know why it costs what it costs after using it. But I just thought it would be something nice and like super bougie to like put on my face after baby girl makes her arrival. So I am taking that with me. Yes. And then I have like some root boost powder for my roots. Face wash, I think I mentioned that. I don't have body wash in there. I'm still going to wind up finding things. I'm sure that they have that at the hospital. I'm not super concerned about that kind of stuff. But yeah, I have all that. And then my nose is so stuffy still. My makeup removing wipes, toothpaste, toothbrush, just like normal stuff. And this like bag pretty much stays packed with a lot of those things just because that's what I use when I travel typically. And I'm taking my makeup bag, and I don't care what anyone says. I know some people are like all about it, and then there's some people that are not about it at all. I feel better with makeup on my face, especially if we're going to be having pictures while we're there. I want to feel, I just feel more put together and more like myself. I haven't worn makeup in days, and even just a little bit on today, I just feel more like myself. So nothing crazy. It's just like normal everyday stuff that I use. And then again, I have more like chapstick and stuff. I just have like one big eyeshadow palette. That way it'll give me like as many colors as I need. And again, I'll just leave that out on my bathroom counter until it's go time. And then I think we're finally almost kind of close to being done. Oh, for the shower, I am taking this big like 2-gallon Ziploc bag with little shower sandals. Hospital floors are so disgusting. Like, they're so gross. I cannot even imagine taking a shower without something on my feet. So I'm going to put those in here to keep everything in my bag clean, but also if they're wet when I come home, they're not getting everything else in my suitcase wet. Also, a couple months ago, I ordered Stars Above is like one of my favorite lines at Target. It's a dupe for Barefoot Dreams. And I ordered 2 pairs of these sandals or slippers. And one I started wearing right away. I have another pair over here. They were like I think they were like $10. And I ordered 2 pairs, and I'm like, I'm going to wear a pair now and take that pair that are already worn to the hospital with me. I don't like wearing socks. I hate the hospital socks. They don't fit right. They're not good. So I'm taking my old pair of slippers with me, and then I'm just leaving them at the hospital. I'm not even bringing them home because they're going to be disgusting, and I'm not trying to bring any hospital nasty home with me. So these I'm also going to leave in this bag. And again, I'm just not going to bring them home with me. I'll just throw them out before we come home. As far as and then I have my hairbrushes. Yes, the one is full of hair. The last thing I feel like doing is cleaning it out right now. I do think that they have a hair dryer. I don't curl my hair. I straightened it a little today, but I don't typically do any of that, nor am I probably going to care. So I have those slippers. And then as far as clothes go, I'm not taking a ton. My coming home outfit, if I have a C-section, is probably going to be the exact same outfit I go to the hospital in, because I'll have it on for like 2 hours. So again, because I just have implants, I don't need nursing bras or anything like that. I just will probably wear my Lululemon sports bra, and then a maternity t-shirt and my Blanky leggings. These are postpartum leggings. Blanky's my absolute favorite. I have the maternity ones on now. I will say this. Do not take your pre-pregnancy jeans with you as your going home outfit. They ain't gonna fit, okay? And if they do, you suck. No one likes you. I'm kidding. But no, like, your expectations of what your body's gonna look like when you leave, like, it ain't that different from when you got there. So, I also do feel, and let me know down below if you felt the same, if you've had a baby. I felt so jiggly and gross, and like I could feel stuff moving around. I hated it. So my hospital did give me like a belly band just because I had a C-section. I needed something tight on my stomach to like hold me together, because I just hated that feeling. I do have postpartum like high-waisted shorts, postpartum leggings that will help with all that. I know a lot of people bring like flowy dresses, and like at the end of the day, it's whatever you're comfortable with. I personally need to feel like a little bit taut in the midsection. So I am taking those leggings. I'm not taking any underwear with me because I'm just going to wear the mesh panties home with the, foot-long pad that they provide. And then also I am going to take this sweater. This is also from the Stars Above line from Target. Again, it's pink. It's one of my favorite sweaters that I have. It's so soft. It's got pockets. I'm going to probably wear this there, but also use this as a robe while I'm there as well. I was going to take my Barefoot Dreams robe, but it's like a cream leopard and I'm not trying to get like blood and God knows what else on it. So I'm just taking this. And then I am taking 2 of the Stars Above's sleep shirts. I have this little like cheetah one and then just a black one. I literally sleep in these every single night, just about. They are the most comfortable, stretchy fabric. These are both extra smalls and I still fit in them. Like that's how stretchy they are. They're so comfortable. And again, it's just for me to be in something like this as opposed to a hospital gown or robe, I just feel so much better about myself. So, whatever you're into, but I'm telling you, like and you need to be accessible. Like you can't wear leggings when you're still at the hospital because the doctors or nurses need to check you, your incision, whatever the case is, like they need to push on your stomach. They still need to access where you are. These button all the way down. They lift up, like if you're breastfeeding, they would come down really nice. Like they're just awesome and they're not expensive either. So I am taking 2 pairs. Could I take an extra just in case? Probably, but at the end of the day, like if these got soiled and I needed to wear a hospital robe, then I would just do that. So that is all I'm taking for clothes. Again, I'm not trying to be at the hospital longer than I need to be. I want to like get in, have this baby and get home and back to life. So there's that. And then the very last thing I have is baby girl's diaper bag. So this is the Luli BB. It was the collab with Tara Henderson. I was really excited to get this because I just think it's really pretty and it doesn't look like a diaper bag. And then it has like this little pocket in the front. And then this is just an itsy ritzy bank holder or pacifier holder. I did not bring or even buy any pacifiers because Xavier loved the ones that they had at the hospital, the event, whatever they are. He always loved those. So I never bought any other pacifiers until he got older. So I'm planning on doing the same for her. So the only things that I have in here for her are her little going home outfit. This is a little pink hat and then a little onesie. I'm just now realizing these don't have feet. So I'm going to have to go grab a pair of booties from her little area, but it does have like the little hand covers. So this will be her coming home outfit or the other one. I can switch it up either way because I do have another one. We did take pictures at the hospital last time and I had a matching outfit and then Eric wore the same color shirt with Xavier and they turned out so cute. So I wanted to make sure to do that again. So I ordered it from Posh Peanut, which is where I got it from last time. And if you guys have not felt what Posh Peanut feels like, it is bamboo and it is literally like the most heavenly material you'll ever feel. So the print that I got, Eric actually picked it out. It's this beautiful like rose print and I absolutely think it is so beautiful and am really glad with that choice he made. So I have a swaddle for her and then I have, oh my God, I can't even stand it. The little onesie. These clothes are so small. It's so crazy. And there's like ruffles all down the front. And then there's little ruffles on the back as well. So this is her little outfit for the pictures. And then there is a matching headband that goes with that. And then there's the matching robe for me. So this I loved. We did last time and they turned out so cute. And then the only other 2 things that I have 2 blankets in here for her. This one was knit by my cousin's girlfriend. I think she's like 16 or 17 years old and she knit this little like baby sized blanket and it matches so well with the print of this outfit. So I wanted to take this with, again, this is not necessary, but it just matches. It's too perfect not to take with. I want to like lay it down in like the little hospital bassinet that they have for like her like name announcement. And then I have this blanket in there too. It's like a Barefoot Dreams dupe. It's this beautiful, so soft pink leopard. It is by Comfy Luxe, and I just got this from like a little retailer by us. So that is it, guys. Oh, no, there's one more thing. And then I also packed, this is literally the only thing I'm packing for Eric besides some macadamia nuts, is a shirt that matches our little photo outfits. So it's just, I didn't want to have to worry about like telling him which shirt to wear for the day of pictures. So yeah, that is it. I feel like I'm forgetting something, of course, but I've like seriously gone over this stuff so much, like I can't imagine that I actually am. So I hope you guys really enjoyed this. I feel a little bit better about life now that this is done and things are kind of all in one spot. I'm so excited to meet her. I really don't think that I'm going to go into labor before C-section, which I'm fine with. I just want her here happy and healthy. And yeah, so if you guys did like this video, please give it a thumbs up. It really helps support my channel. And if you have not subscribed, I would love for you to do so and become part of my YouTube family. I hope you guys have an amazing rest of your day, and we will see you very soon in hopefully a birth vlog. Love you guys so much. Thanks for watching.